Sonia Nguyen. I work as a nurse practitioner and I work at the Putnam office building as an OB/GYN nurse practitioner. In high school, I volunteered at a local hospital at the front desk, something so simple, and that kind of exposed me to the medical field. And when I was in my early 20s, for my first undergraduate degree, I worked in an ER registration and admitting a hospital for a level 1 trauma center. And that preempted me to get into my nursing program. My second degree was in nursing, and I obtained that from Roseman University of Health Sciences. I was so fortunate that I was able to get into labor and delivery, grew my nursing career in labor and delivery and postpartum. I was a perinatal nurse, and that grew my interest into wanting to go back to school for my master's program to become a nurse practitioner. And my third degree, which led me to my nurse practitioner degree, was my master's degree from United States University. So my career right now as an OB/GYN, that I think correlates to my career as a nurse, working in labor and delivery, working in postpartum, and that experience as in the inpatient setting has really helped me relate to patients in the outpatient setting. Sometimes I see them and we're Googling while I'm doing their intake and assessing them. Also, when I see patients in the outpatient setting and I round on them in postpartum and I realize it's them, and it's nice to see the full circle that I've seen them in pregnancy and I've seen them postpartum as well. Other families are important when dealing with a patient because they are their support system. They are there when they're assessing any patient needs, supporting them through their medical appointments, through their medical cares. I try my best to spend as much time I can with each patient, make sure that they feel like all their questions have been answered. I am married. I have a son who's almost 2. And being a mom is so great. It really does test your patience. It really does bring so much growth to you as a person, definitely in terms of relating to other people with kids. I do enjoy working out just to help kind of de-stress, and it's good for the mind, body, and soul. I also enjoy spending time with my son, my husband, even going to parties, going to parks together, activities, just things like that to kind of help have a good work-life balance. The great thing about PIH Health for me has been the great providers that I've been able to work with, whether it be in my group, the great medical assistants that I have in my office, and the nurses that I have in the inpatient setting. And they have all been so wonderful, and just the teamwork and collaboration that we're able to provide for patients. I do love what I do.